The proximal attachments of the rhomboids are onto the spinous processes of C7 down through T5. More specifically, the proximal attachments of the rhomboid minor are onto the spinous processes of C7 and T1, and the proximal attachments of the rhomboid major are onto the spinous processes of T2 down through T5. From there, the rhomboids run laterally and inferiorly, and their distal attachment is onto the medial border of the scapula from the root of the spine of the scapula down to the inferior angle of the scapula. The upper trapezius attaches into the medial 1/3 of the superior nuchal line of the occiput and the external occipital protuberance and the nuchal ligament and the spinous process of C7. From there, it runs distally to attach into the lateral 1/3 of the clavicle and the acromion process of the scapula. The middle trapezius attaches into the spinous processes of T1 through T5. From there, it runs distally to attach into the acromion process and spine of the scapula. And we are looking at the Teres Major muscle on the right side of the body. For context, the deltoid muscle has been added into this figure and it has been ghosted so that we can see through it. The proximal attachment of the Teres Major is at the inferior angle of the scapula and on the dorsal surface of the inferior 1/3 of the lateral border of the scapula. From there, the Teres Major runs laterally and anteriorly, and we can say distally, to attach onto the medial lip of the bicipital groove of the humerus, which we cannot see in this posterior view. We have a posterior view of the right shoulder girdle region, and we are looking at the infraspinatus muscle, one of the 4 muscles of the rotator cuff group. For context, we have also added in the supraspinatus and teres minor muscles, 2 other muscles of the rotator cuff group, and they have been ghosted in with less density so that we can see through them. The infraspinatus attaches proximally into the infraspinous fossa of the scapula. It then runs distally to attach onto the greater tubercle on the head of the humerus. We have an anterior view of the right upper trunk region, and we are looking at the pectoralis minor muscle. For context, the coracobrachialis muscle has also been added into this figure, and it has been ghosted in with less density so that we can see through it. The proximal and distal ends of the pectoralis major muscle have also been added into this figure and ghosted in with less density. The proximal attachments of the pectoralis minor are ribs 3, 4, and 5, where these ribs meet their costal cartilage. From there, the pectoralis minor runs distally, and its distal attachment is onto the medial aspect of the coracoid process of the scapula. We have an anterior view of the right arm, and we are looking at the coracobrachialis muscle. For context, we have added in the deltoid muscle, ghosted in with less density so that we can see through it, and we have added in the distal end of the pectoralis minor muscle, also ghosted in with less density. The coracobrachialis attaches proximally onto the apex of the coracoid process of the scapula. From there, it runs down distally to attach into the middle 1/3 of the medial shaft of the humerus. And the scapula has been ghosted in with less density so that we can see through it. The serratus anterior lies between the scapula and the thoracic ribcage wall. The proximal attachment of the serratus anterior is onto the anterolateral surfaces of ribs 1 through 9. From there, the serratus anterior runs posteriorly, and its distal attachment is on the anterior surface of the entire medial border of the scapula, the medial border from the superior angle all the way down to the inferior angle. We have a posterior view of the right arm and forearm, and we are looking at the anconeus muscle, a muscle whose belly is located in the superficial compartment of the posterior forearm. For context, we see that the triceps brachii muscle has also been added into this figure, at least the distal half of it has, and it's been ghosted in with less density so that we can see through it. The anconeus attaches proximally onto the lateral epicondyle of the humerus. From there, it runs distally to attach into the lateral surface of the olecranon process, as well as the lateral surface of the proximal 1/4 of the shaft of the ulna. And we are looking at the supinator muscle. For context, the anconeus muscle has been added into this figure, and it has been ghosted in with less density so that we can see through it. And also the extensor carpi radialis brevis and extensor carpi radialis longus muscles have been added into this figure, also ghosted in with less intensity. The supinator muscle attaches proximally along the lateral epicondyle of the humerus and along the supinator crest of the ulna. From there, the supinator runs laterally to attach onto the posterior, lateral, and anterior sides of the proximal 1/3 of the radius. And we are looking at the palmaris brevis muscle, an intrinsic muscle of the hand that overlies the hypothenar eminence. For context, we have also added into this figure the distal tendon of the palmaris longus, as well as its palmar aponeurosis distal attachment, and we have added in the flexor retinaculum. The palmaris brevis attaches from the flexor retinaculum and the palmar aponeurosis, and then it runs in the ulnar medial direction to attach into the dermis of the skin on the ulnar side of the hand. We have an anterior view of the right hand, and we are looking at the abductor digiti minimi manus, one of the 3 muscles of the hypothenar eminence of the hand. The abductor digiti minimi manus attaches proximally into the distal tendon of the flexor carpi ulnaris muscle, as well as the pisiform. From there, it runs distally to attach into the ulnar, the medial side of the base of the proximal phalanx of the little finger, as well as into the dorsal digital expansion of the little finger. We have a right lateral view of the pelvis, and we are looking at the gluteus medius muscle. For context, the piriformis has been ghosted in with less density so that we can see through it. The gluteus medius attaches proximally along the upper aspect of the external ilium, beginning just inferior to the iliac crest. From there, the gluteus medius runs distally, attaching onto the lateral surface of the greater trochanter of the femur. In this video lesson, we are going to explore the origin and meaning of the names of the muscles of the auricularis group. The word auricularis comes from the Latin word referring to ear. Anterior is Latin, meaning in front of. Superior is Latin, meaning above. And posterior is Latin, meaning behind. Therefore, the auricularis anterior muscle is located in front of and attaches into the ear. The auricularis superior muscle is located above and attaches into the ear. And the auricularis posterior muscle is located behind and attaches into the ear. These are the muscles of the auricularis group. In this video lesson, we are going to explore the origin and meaning of the name of the muscle levator anguli oris. The word levator tells us that this muscle elevates one of its attachments. The word oris refers to the mouth, and the word anguli refers to the angle of the mouth, in other words, the corner of the mouth. When the levator anguli oris concentrically contracts and shortens, it will lift its inferior attachment on the mouth up toward the superior attachment on the maxilla. In other words, the levator anguli oris elevates the angle of the mouth. Levator anguli oris. In this video lesson, we are going to explore the origin and meaning of the name of the muscle risorius. The word risorius is Latin for laughing, and when the risorius concentrically contracts and shortens, it would pull its more medial attachment on the angle, the corner of the mouth, out laterally toward its more lateral attachment. This would widen the mouth, which is part of the facial expression of laughing. So the name risorius literally means laughing, and this muscle helps to create that facial expression. Risorius.